The care that we give at Trinity Cancer Center is quite unique in that we have the most compassionate care. We give personalized care to our patients. So it's really a combination of a high touch and a high technology that we can deliver for our patients at the community setting. One of Trinity's value statements or mission statements is to provide for the health of our community. And we live that through the Cancer Center. We have a world-class research program that's offered right here at Trinity, and we have access to clinical trials through the National Cancer Institute that normally you would find at an academic medical center, but we offer them at the community level through our connection with Mayo Clinic. The Cancer Center is not just a Trinity-based program. We're really looking to the community. It's an outreach. Breast cancer is a very personal diagnosis, but you're not alone. There's a whole community of healthcare providers, caregivers, of resources to help you through this time. You don't stand alone. We all stand with you, and it's a very hopeful environment.
I came to the Quad City community 29 years ago. At that time, the cancer program was already being fully developed. It had excellent radiation therapy. Dr. Stoffel was already here. Before him, Dr. Rathy was giving radiation therapy. They had state-of-the-art equipment at that time. They had a cobalt machine, and subsequently they've acquired state-of-the-art equipment whenever they've needed to over the years. At the present time, they have several linear accelerators to give the best radiation therapy around, and it's all integrated with computers and intensity modulation and all sorts of fancy mathematical programs so that now we can save normal tissue damage and very much concentrate radiation therapy on the tumors. For those of us that are involved hands-on in patient care, particularly in cancer care, it's a lot of religion. It's a lot of religion and science. It is a duty to do the best that we can for God's children. Almost on a daily basis now and in the past, the patients give me lessons. They give me lessons in courage and strength and faith, which I think make me a better person and hopefully a better doctor. And as best I can, I now try and pay it forward. There was a lovely lady who presented 2 or 3 months ago. She transitioned to heaven about 2 or 3 weeks ago. And we all did our best, and we tried hard, and she still got to heaven quickly. But every day, all that she did was smile at me through the pain and thank me for being nice to her and trying to help her. What I would say to the people that might be at the event and other people who have been afflicted with cancer is try and stay courageous. Know that the nurses and the doctors who have the privilege of being their servants are going to work as best they can in their best interest to do what we're supposed to be doing, and that is to lessen their suffering and to make sure that they don't get to heaven prematurely.
There were a lot of people on the Trinity team that helped me. Everybody was truly caring. They took the time to be interested in how I was doing. One person in particular who really helped me was Caroline Robinson. She is a cancer educator at Trinity. I'll be forever grateful to her for her work. She'll say, "Oh, you know, I was just doing my job," but you know, in reality, she has really touched me. My cancer was found on a routine mammogram. Just in a year's time, you know, I had metastatic breast cancer. Sometimes you think it's not necessary, you know, you get busy and that year goes by very fast, but it saved my life. My first thought after the diagnosis really was about my daughters. Will they now kind of be saddled with having to face breast cancer in their life? And the next thought, of course, was, will I be able to see these little boys grow up? The thought of not being here to see them grow was just, you know, devastating.
I don't know, I kind of expected to go into the doctor's office and it'd be kind of doom and gloom and, you know, a real sad place. A lot of sad diagnoses come from there, a lot of sadness, you know, just in the staff and all that, and it wasn't that way at all. It was upbeat, it was inspirational.
One thing that really impressed me the very first time that we ever went to see her oncologist, he said, number one, that this is an interview. This is an interview for you to interview me for your care. He was putting his knowledge in her hands, saying, how do you know, what do you think is the best route to treat this disease and what are you comfortable with? And I really thought that was just very impressionable upon me.
Being diagnosed with breast cancer, going through the treatment is obviously no fun, but life after breast cancer is fun. There is life, and there is good life after breast cancer. You realign your priorities. I think you figure out very quickly what's important in life, what's important to you.
I think we have definitely come together as a family more. We spend more time together, we see each other a lot more often.
We try and take time to remember that, you know, every day, make every day count for something. And I think we have.